said, my name is Jessica Walls-Lavelle. I am the Southwest Director for Governor Tom Wolf. I've been in the position about 5 months, so if I haven't met you or spoke with your organization, I would love to do that. So please feel free to introduce yourself to me, and I'd love to get to know everybody. My background, I worked in progressive politics and electoral politics before this. For about a year in 2015, I worked on a campaign called PA Competes, which I don't know if you remember, but it was our campaign to pass statewide non-discrimination legislation, which we are still fighting for today. But I want to take a moment right now to recognize the work and planning that the Western Region Tobacco Primary Contractors have put into this conference. Adagio Health, Erie County Department of Health, and Tobacco Free Allegheny. Thank you all for bringing us together today. As I'm sure you're familiar with, the Governor's Office is working on better health outcomes for all individuals in the Commonwealth every day, and we are dedicated to providing policy that helps us achieve this goal. One of Governor Wolf's first priorities when coming into office in early 2015 was expanding Medicaid under the Affordable Care Act, which the prior administration had refused to do. That means today there are more than 700,000 Pennsylvanians that have gained access to health insurance that wouldn't have it otherwise. And as I'm sure you know, the governor has long been a champion of LGBTQ rights. He staunchly supports and continues to speak out on the need to pass comprehensive non-discrimination legislation in Pennsylvania that includes gender identity and expression. And this continues to stall in our legislature. So we all need to keep advocating for that. But he's doing what he can. In 2016, the governor put into effect 2 executive orders, one that covered state employees and one that covered state contractors and all of their employees, that protects those individuals from discrimination, including sexual orientation, gender identity, and expression, which we estimate covers an additional 100,000 people across the Commonwealth. In 2015 and 2016, the Pennsylvania Department of Health and the Bradbury Sullivan LGBT Community Center piloted regional health needs assessments to measure LGBT health disparities in Pennsylvania. Those findings inspired the organization of this annual conference, so that the group gathered here today could further explore how we can overcome those shortcomings. And we're very lucky today that the executive director of that community center, Adrian Shanker, is here with us today and will be participating in one of our upcoming breakout sessions. Complete side note, Adrian and I were both fellows in 2011 at the Center for Progressive Leadership, so it's always good to see my fellow fellows doing well. But what we know today is that effectively serving LGBTQ patients requires medical providers to better understand the cultural context of their patients' lives. It requires that they modify policies and environments in order to be inclusive. It requires they take detailed and non-judgmental histories while at the same time educating themselves about the health issues that are important to their patients. And it also requires providers who are willing to reflect upon and change personal attitudes that might prevent them from providing the affirmative care that LGBTQ individuals need in order to achieve better health and wellness. But sometimes you need a great teacher who can help you reflect and who's willing to put in the time and effort to be a leader in areas where it's not always easy or comfortable to lead. And in 2018, the governor created the Pennsylvania Commission on LGBTQ Affairs. It was the first of its kind in the nation. Our commission is led by a person who is willing to put in the time to help others reflect and change. Todd Snovel is the executive director of the Pennsylvania Commission on LGBTQ Affairs and will be our keynote speaker this morning. Todd has worked in the engagement and inclusion space for many years, most recently at Lebanon Valley College, where he led the team working with students in the co-curricular experience and initiated campus-wide efforts in equity, diversity, and inclusion. Todd also teaches college-level courses on the studies of genders, sexualities, and identities. He approaches his current role with energy and passion, which you will see in just a short minute, and he is helping to break down barriers across the state and the country. And it is a pleasure to introduce my friend and colleague, Todd Snovel.
Well, good morning. happy LGBTQ Health Conference. Happy Pride Month. Happy lots of things that we're celebrating. I'm going to make this just a little bit more informal if you don't mind, and I'm going to hold this. Oh, much better. I hope you have been having as great of a Pride Month as I have. I was just telling some of my table mates, please excuse if I turn a little Kathleen Turner in my keynote today. The month is catching up a little bit to me, so we counted, and we will somehow support 52 events across the Commonwealth this month. And that's fantastic, and we're not done there. We will continue here in the Commonwealth to see prides and pride festivals happen all the way through August, so the party has just begun, and I hope that you will continue to support them, whether they're in your community or you're finding a new one. Speaking of finding new ones, this is my first time in Cranberry Township? Township. Cranberry Township is the actual town. Yeah, that's interesting. Okay. Cranberry Township, Pennsylvania. So I've been doing all kinds of exploring in the few hours that I've been here. And it's great. I'll give you just a little bit of background on me. So you heard my name is Todd. My pronouns are he, his, and him. I am not a Western PA original person. I know especially in Pittsburgh, that's one of the first things I'm asked, right? Are you from here? I have to say, I'm sorry, I'm not. I'm an Eastern PA boy, so I grew up in Bucks County, so north of Philadelphia. Any Bucks Countyers in the room? Yes, okay. Fantastic. Then moved to the central part of Pennsylvania, where, as you heard, my career took me into higher education, most recently at a small private liberal arts school called Lebanon Valley College. And as I tell the story, I had just actually returned home from taking a group of students on a service trip to Puerto Rico. We were doing ecological restoration work to repair some of the mangrove forests in Puerto Rico. We had just gotten back. If you know higher education, it was late May. It was, thank God, summer mode, right? Stretch back. We didn't have a lot of students on campus, a time for planning and sort of catch up. And my cell phone rang. And it was a number that I did not have in my phone. So what did I do? Nope. And then kept typing or doing whatever I was doing, and I looked down at some point, and I said, oh my gosh, a voicemail, right? Like, it's like a thing of the past, especially when you work with college students. I would always be like, you know, this thing actually goes here, and you can speak into it. It's just not a text machine. But anyway, so I see a voicemail, and I think, oh, I should listen to that. And the person on the other end of the line said, I'm calling on behalf of the Chief of Staff to Governor Tom Wolf. We would like to have a 10-minute phone call conversation. And my first thought was, how did I piss off the governor? I have absolutely no idea what I've done, but obviously this is something punitive and I'm in trouble. And it wasn't. What it was then what would go on to be a few, literally months of conversation leading up to an amazingly historic event when Governor Tom Wolf signed an executive order to create the United States' first statewide commission on LGBTQ affairs. So I never am in a space where I don't follow my colleague in giving a shout out to who has orchestrated all of this, which is our big boss guy, Governor Wolf. LGBTQ people and communities remains a priority in his administration, so much so that we now exist and are able to do this work, and we're so thankful to the governor to be able to do that. I want to acknowledge, I know we have Kathy Cameron and Adrian Schenker right now in this room that represent the commission. Commissioners, there are 40 of them, so commissioners, I'm sorry if there are others in the room that I did not see yet. You will have a chance to meet some others as well that will be on panels and different presentations for you before your time is up in these next 48 hours. Let me tell you, pressure is this. Pressure is being asked to do a keynote on LGBTQ health when Adrian Schenker is in the room. I'm basically right now giving my doctoral dissertation to my chairperson, right? Like the person who just like, oh, I just went on I'm ready to go on a book tour around the book I published on queer health, right, is sitting in this space. So just let me tell you, you want to improve my health, Give me all those smiley faces at the end of this. If you give me frowny faces, my health will drop, and we don't want that to happen, right? So, let me give you some macro level, why do we exist, right? So, some folks that don't understand say, like, I don't get it, right? Why would this have to exist? We have marriage equality. Isn't that everything we need for LGBTQ people? Like, why now do we have to have a commission? So, here's some of the things that we do, right? So we are the governor's chief advisor when it comes to holding with intentionality LGBTQ folks and communities, when it comes to policies and procedures and regulations. So I don't just work with the governor, but I'm very fortunate to have open lines of communication to the secretaries and our policy directors in all of our state agencies. We gather about every 6 weeks to literally just have an information session to say, what are we all thinking about? What are we all dealing with? How have we looked at our policies in different areas, right? And perhaps widened language. How have we looked at, are there unique challenges or barriers to service in some of our state agencies for LGBTQ people? And so whether that's health or human services or PennDOT, believe it or not, PennDOT is around that table, right? We're working with them now to look at driver's license, where we have to right now choose a gender marker on those in Pennsylvania. That's not the model every state has now adopted. So bringing all of these state agencies around the table and sort of being that intermediary between them and the governor, quite honestly, I know I can say this in this space, also looking at what's happening federally and how sometimes rollbacks or proposed federal mandates are really negatively impacting our community, and if there are things we can do on the statewide level to hopefully propose further support for LGBTQ folks. We do very intentional work in the areas of health and human services, education, employment, and business formation. We work alongside the Commonwealth specifically in their own hiring processes, their own policies around non-discrimination. As Jessica told you, the governor signed an executive order way back to make sure that within the Commonwealth there could be no discrimination based on sexual orientation, gender identity, and gender expression. We serve then as a resource group in community. I love my colleagues in state government. I love, if you've been to the Capitol building, it's beautiful, right? It's a beautiful environment to work out of, but I think that sometimes our real strength and power comes when we're in communities, when we're listening to folks, when we're actually hearing about unique needs in each community, in each subset, with each population. I cannot just sit in Harrisburg and sit around tables of appointed and elected politicians and say, here's what we should do, if I am not informed by the lived experiences of our LGBTQ folks in Pennsylvania. And so while I have spent more time on the Pennsylvania Turnpike than I probably have my entire life in the past 10 months, I have embraced podcasts into my life. They keep my mind working while spending lots of time in cars. Like I said, I will try to be as aggressively in community for things that are happening, again, to stay informed and to stay active and present for LGBTQ folks across Pennsylvania. And the last bullet point that the governor wrote into the executive order says that we promote the cultural arts of LGBTQ communities throughout the Commonwealth. And I have joked with the governor and I have said, I believe that one was just a gift to me. My background is in the arts. And I said, oh, well, that was just so nice. You just threw that in there so that I could keep doing that. And that's great. We do a lot. We are not without projects in our first 10 months. I will tell you that we sort of swing on this pendulum, and it goes between being incredibly rewarding and being incredibly terrifying. In saying, I've never been in a position before, right, where I was asked to do something and said, there is no rule book, there is no manual, there is no one who has done this before. So sort of figure out what the commission should do. You know, in higher education, we'd be like, oh, we should do an innovative program. But you know how we define innovative programs? The ones we Google. Or the ones we were at a conference where that school wouldn't see us go back and steal something and be like, I just have a new idea for a program, right? So it's not quite as easy this time around. Like I said, at least at this point, we don't know of any other state that has put this into place. So when I always say, I'm going to call my counterparts and my colleagues from the other states and see how they're handling all these things, I usually respond by saying, well, no one's picking up the phone, so I guess I'll figure it out again. However, you know, the other thing that I would say is, you know, and this will sort of launch us into what I want us to talk about, which is, you know, what does health really mean for LGBTQ communities? A week has not gone by in 10 months. Literally. A week has not gone by in 10 months that our office has not just been the place that folks have expressed their pain and their hurt and the trauma that they are facing here in Pennsylvania. And I don't know about you, but it is very hard for me to conceptualize, you know, that we are just sort of allowing this to happen here in our state. We are doing so many things so well and making Pennsylvania such a great place to live for so many Pennsylvanians, yet we are not doing enough. Because I cannot express to you enough, every week we have news stories of people living in utter trauma, of people not living with quality health. And so I hope that we will all be challenged to think how we use our voices individually to then be collectively advocating for what we can do to make those things better. So, you know, sometimes a lot of you deal in health spaces every day. And so sometimes the passions that you bring to the table and the unique ways that you address healthcare, either as an individual or through your system or through your organization, creates a more finite way in which we might define health or how it shows up for the work that we do. But I thought to myself, right, I'm not a healthcare provider. My background is not in healthcare. It has always been a passion of mine, especially access to healthcare. However, you know, it is not the bailiwick of what I have done professionally. And so I thought to myself, well, what really is health, right? How do we define it? And so we know that we have the system of healthcare as a system put in place to advance everyone in what we would hope to be to attain an optimal sense of health. And when we think about that holistically, that means physical, mental, emotional, and social well-being. It is not merely the absence of disease or infirmity, but the World Health Organization tells us that if we are living in the ideal world that we hope to establish, we would be in a society where every single citizen was equitably achieving optimal health, where every person was living with lack of disease, with the body performing at peak performance, where a person was always achieving regular exercise, balanced nutritional diets, and attaining adequate rest. It would also mean that each person was currently in a mental and emotional state that allowed them to enjoy life, bounce right back from difficult experiences, achieve balance, adapt to adversity, feel safe and secure, and achieve their full potential. So here's my question. If you believe that your environment currently is promoting every single one of those things to be 100% in your daily work, please stand up. Right? So it sounds great. How wonderful to think that we would ever be in a society where all of those buckets were full for every single individual. And yet, right, even in this room, you know, and I'm just going to say, I bet in this room we got a whole lot of privileged identity going on, right, in certain ways. None of us feel like we are achieving optimal health. And so thinking about what we experience through that, thinking about what is put on us that sometimes does not allow that to happen, and then most specifically thinking about how our LGBTQ communities can be at even more risk for non-optimal health than sometimes others can be. So we know, I would say, think about all of those things of which mean optimal health, try to achieve them all, and then at some time, wake up from the dream and keep living life. At least that's what I feel like. I always say this is the biggest curse to humankind. It would be so nice if a response ever to an email at 9 p.m. was not, thanks for getting that to me, but was, why did you just send that at 9 p.m.? But we're not so good about that with our organizations sometimes, are we? Right? No one has to have testimonials like, I'm sorry, it was me. Right? We've all done it. So we know that there are numbers of things that come into play when it comes to our health. We know that there are variables to it. We know that there are outside factors that come into it, right? We know that, for instance, geography can have impacts on health. I wish, right, at least this is my wish, that we all lived along the Mediterranean coast, where we were like, well, yes, I've had nothing but fresh meat and fruits and vegetables and chugged olive oil after every meal, and look at the optimal health that I have. But for most of us, and especially when we look at some of the health statistics here in the United States, we know that we are not living as a society in optimal health, and we can quantify that in a couple of ways. So some things that we know, here in the United States, we are the largest global consumer of weight loss products. We consume 80% of weight loss products on the globe. And as that incredibly largest consumer, we still have the leading rates of obesity and people living with a diagnosed unhealthy lifestyle. Interesting. The percentage of American children and adolescents that are considered overweight has tripled since 1978. More than 70% of adults across the United States now have already been diagnosed with a chronic disease. And 1/4 of the more than $3 trillion that our nation spends on healthcare costs are being used to directly treat and manage those illnesses. But we also know that it has to do a lot with just more than geography, right? We, in the world of healthcare, started to be much more observant around access and treatment for healthcare, and in doing so, we noticed something called disparities, right? We noticed that health disparities existed within our spaces. We noticed that these were preventable differences in the burden of disease and injury and violence or opportunities to achieve optimal health that are experienced by populations that are often thought to be socially disadvantaged. So again, what are things that can affect this? It can be defined by factors such as race and ethnicity. It can be biological sex. It can be educational level. It can be income level, ability level, geographic location, and of course, sexual orientation, gender identity, and expression. These health disparities are inequitable and are directly related to the historical and current unequal distribution of social, political, economic, and environmental resources. I'm going to clue you in on something because I truly find it absolutely fascinating, and I'm not supposed to do this. Well, actually, I can do this. It's 10:03. So, right? I was able last week to go to a closed session that the United Way of Pennsylvania hosted. And literally, right now, this morning at 10 a.m., they are holding a press conference to make their ALICE report public knowledge. And basically what their ALICE report stands for is an economic study that was done in Pennsylvania that looks at this group of people that they use the acronym ALICE for, that essentially are folks that live household income above the federal poverty level, but yet below what would be quantified as basic survival needs. So they are not considered living in poverty by the feds, but yet when we look at, and I will tell you, when you look at this data, incredibly conservative budgeting for what people actually need to survive, right? And I'm telling you, this monthly budget, there are no frills. There is no cable. There is no internet. We are assuming people are using their cell phone in somewhere with free Wi-Fi, right? Like there is no frill. So the folks that live above poverty but still below this survival need, when you put together those in Pennsylvania living under federal poverty plus this group category now living in Alice, it equates to 40% of Pennsylvanians. So, what I would tell you is, when we think about the ways that we define health holistically, we now know in some respects that almost half of our state's population are not achieving health. Because what I would argue is, if you are every day trying to consider how ends will meet that day, are you ever going to actually feel healthy? So, I was sworn to secrecy around this till 10 a.m. I'm going to tell them it was 10:02, right? I was allowed. This will become public. You will actually be able to see demographic information regionally and by county. So for those of you who do, county-based or regional healthcare work, you can see exactly how this is showing up with the populations you work with, as well as a whole bunch of strategies on what to do with this. So please get in touch with me if I can be helpful to disseminate to you, because I'm very passionate about it, and I think it's really going to be some really great new data to inform the work that we do. Excuse me. I'm going, if you will allow me, again, as a non-healthcare professional to do an LGBTQ health keynote, I was like, ooh, this is going to be interesting. I'm going to share with you a little bit more of my personal story than what I've really ever done in a setting like this before. So I hope you will give me some grace in order to do that. So I told you I grew up in Upper Bucks County and then moved to the central part. I'm adopted. My adopted parents, my father is now retired, but a minister in a Protestant faith background that tends to be incredibly conservative. My father was also a tri-varsity letter high school and college athlete who is 6'6" and can essentially eat anything without his body type ever changing. Yeah, great, right? Here comes Todd into their family, and as Todd started coming to late childhood and adolescence, Todd really started to realize some things about himself. And Todd started to realize that he did not necessarily experience all of the same feelings that his peers were talking about. Now, I will tell you, it was a very unique and challenging time in that, quite honestly, the acronym LGBTQ, I would have had no idea what that means. I think I had heard of the word gay, but I would tell you that the only way I knew that to be used was in incredibly negative experiences and seeing incredibly upsetting and disturbing imagery with that. I did not know a single person in my family who was LGBTQ. I did not know a single person in my community who identified as LGBTQ. To my knowledge, even from graduating high school, we did not have an out member of our graduating class or anyone in the school. It was not until college where I actually met someone who openly identified as LGBTQ. And quite frankly, I grew up in an environment where the church was not just what gave us spiritual betterment. It was really our only social outlet. The only kids I played with were kids from the church. The only people that we really experienced in our lives were folks from the church and parishioners of my father's. So, the complex thing was the church meant so much in so many avenues of life, and yet again, my father was a United Methodist minister, and it was the time in which the Conference of the United Methodist Church was struggling very much with the idea of LGBTQ folks within the church. I wish I could tell you they're not still struggling with it, but They're still on the journey, as we all are. So again, right, the only kind of outlet that I knew of for all of these things was also just continuously talking about it being a negative thing, being sin, being negative, being the AIDS and HIV epidemic, being the disease that God was sending to folks living unclean and unhealthy lifestyles. And so, while I'm not sure I would have told you that I knew this at the time, I developed coping mechanisms, as we all do when we face adversity. And one of my coping mechanisms was food. It served a number of things for me. One was just an absolute comfort in times that I was feeling scared and upset. But it also allowed me to sort of live within this shell of myself. So, I was not genetically related to my father. I did not have his genetics. I am a person genetically who struggles with weight, right? I can have a cheat day, but I know what will happen, and I am okay to say, right, that I know that I will always be a person who, I have a struggle with weight. And so what food allowed me to do was to put on weight so that in my mind, no one would ask why I wasn't dating because of my size. They wouldn't suspect that it was because I didn't want to date girls. It would just be, well, given how heavy Todd is, right, that's why he's not dating, or that's why intimate relationships are not something that he's interested in right now. And that sort of helped me sail through all of my adolescence. I would tell you that I lived as a person of pretty extreme weight, starting at age 10, going through all of my teenage years and into college. When I was graduating from college, it was my last semester, and I was student teaching. And so two things had to happen. One, had to step up my clothing game, right? Because now I'm going to be a big teacher and kind of wear some nice things, right? Gone are the days of like rolling out of bed and putting on like sweatpants and going to class. That's not going to happen in the field. And two, right? You have to be cleared with a physical in order to student teach. Even as a person of pretty extreme weight, I will say, I was pretty healthy in that, like chronically, I did not get sick a lot. And so I could avoid doctors, right? And I could say, well, I know that genetically, I'm prone to being bigger. I'm not going to quantify it. I don't know what I weigh. I'm sure it's not as bad as other people. I'm a healthy person, I'm active, so, I could kind of give all of these reasons for why it was never necessary to actually think about my weight and or seek medical advice on it. So, I talked about those two things, right? So when people say, oh, Todd, why did you make a change? And I want to say, oh, it was for my own health. No, it was vanity. Meet Todd, yep. So I distinctly remember standing in, this will date me, a dressing room of JCPenney, and I could no longer wear a size of pant sold even in the big and tall section of their department store. And I stood there looking in the dressing room mirror, and I stood there looking at what I believe was a 54-inch waist pant, not being able to put it on, and saying, is this what you want? Coupled with, a few weeks later, I went to that doctor's visit, and I thought I was being coy, right? So I walk in, and, they take my blood pressure, and the medical professional says, we're going to do height and weight now, if you want to get on this scale. And I averted my eyes because, right, I didn't need to see this number. What's in a number? You shouldn't have to know the number. And didn't that darn medical professional say it out loud as she wrote it on the clipboard? And I heard 330 pounds. And for the first time in my life, truly, I knew what I weighed. Now, I would tell you, right, we should not be obsessed with just numbers. Numbers do not tell us an accurate story of our own health and our own bodies, but at the same time, when you don't know the number, you come up with all of these narratives on why the number is not going to be what it is until you hear the number. So for all of these reasons, right, I finally decided it was time to do something. And so, I essentially started my own program, right? I don't tell anyone that I have a magic secret, but for me, right, I'm one of those folks that if you tell me what I can and cannot do, one, you annoy me, and two, I don't listen to you. Welcome to state government. Whoopsie. But I said, how can I take this into my own hands, right? So if I'm the one saying I don't want that right now, I'm in the driver's seat, I made that decision. I can live with that, right? And so for me, it was not so much about I couldn't eat this, or I could eat this, or I had to do this in a workout regime or anything like that, but more, how was I looking at my overall lifestyle? And by looking at my overall lifestyle, it was not just exercise, it was not just eating, but it was all of the things those were tied to. And it was about accepting me exactly for who I was. And that was a struggle, friends, right? A lot of us have been on that bus, and and all of our narratives are very different, and yet there are lots of things that sometimes bring them together. And so what I would tell you is that, I'm very lucky to have been able to maintain my weight and live in a much more healthier lifestyle, and that lifestyle also allows me to be authentically who I am. I will joke with you that if I think about, chapters in a memoir, it's a little staggering to me to think, right? I struggled for a long time to even publicly acknowledge being a member of the LGBTQ community, and now I am essentially the head homosexual of Pennsylvania. That's a journey. Yeah, thank you. But, right, it truly, I hope, provides this portrait of just how interrelated so many of the things that affect our health truly are. If you're wondering, I will tell you, I do still have relationships with my family. As you heard me say earlier, everything is a journey. We are not at 100%, but we're also not at 0, right? So every time we tick that percentage up 1 point, it's a victory. And, I'm giving folks a lot of grace and sort of, an internal struggle in rethinking and now seeing something very personal in places that could always just be sort of ambiguous, right? So if you want to know more about that, we can talk later, and I'll tell you all about it. I think also when we think about LGBTQ care, we have to think about the spectrum of care, right? It's not just talking about the optimal care of an LGBTQ person who is 40. It's talking about what we're doing for queer youth. It's talking about what we're doing for our LGBTQ elders. It's talking about what we're doing for the populations of LGBTQ folks in Pennsylvania. You know how many counties they're in? This is a trivia question. They're in 67 counties. Do you know how many counties Pennsylvania has? 67 counties, good job. But that is literally like eye-opening to some people in rooms. And, again, let's educate ourselves. I'm all about it, so no harm, no foul if you did not know that. But, sometimes I go to places and they're like, well, what have you been doing in Pittsburgh and Philadelphia, where the LGBT people are? I said, I know you might see them more en masse there, but they're actually everywhere. So we're in 67 counties, supporting people in 67 counties. Yep, we are. I know this just in. That's really big. The other thing that I would tell you is I didn't want to spend a lot of my time talking about the PA assessment for LGBTQ health needs, because there are going to be amazing breakout workshops where the folks who drove and created and lifted and facilitated that amazing product to happen will be able to walk you through that. And so that's a quick shout out. When you see those breakouts, please go to them, or if you don't have a chance to go to them, please download the report and look at it, because we are so fortunate to have data sets and information informing our exact populations here in Pennsylvania. And shout out to my friends and colleagues that made all of that happen. So thinking about that spectrum of care, what are some of the things that we need to do? So we know that the youth segments of our LGBTQ population are at very particular risks for issues. Maybe some of you have services that are provided specifically to youth. And we know also, which is also true of all of our LGBTQ communities, that we need to look with an intersectional lens at the ways that we are engaging with LGBTQ communities. You hear my intentional plural of that term, right? Because it is in those intersectional areas where unique challenges can exist, right? So the health needs of white gay men, such as myself, are going to be very different, right? Both from biological needs as well as the social things put on us than, for instance, trans women of color in our communities. And we need to acknowledge and understand the uniqueness that intersection brings to these conversations. So, when we think about school environments, when we think about health of LGBTQ youth, we think about encouraging schools to establish clear and inclusive policies around supporting LGBTQ youth. Again, remember, feeling daily safety is health. So if our students are constantly going into schools where they are not being respected with the use of their names and pronouns, where they are constantly being ridiculed for who they are or whom they love, where they are constantly not being able to use facilities that align to who they are constantly in environments where they are not feeling safe. We ask that our schools become educated on these things, right? We don't necessarily assume that every school board is going to know how to be a gender inclusive school. That's okay. Not figuring it out is not okay, right? And so how we can all promote education of our folks in educational areas, having our schools be very visible and vocal around their LGBTQ equality, right? So we are very fortunate, and we've had a lot of advocates working with the Boyertown School District. If you didn't know, the Supreme Court has recently said we are not hearing that case, which essentially has affirmed trans students being able to use, and gender nonconforming students being able to use facilities that align to their gender identity, which is huge precedence. And it was national precedents that came based on the bravery of some of our students here in Pennsylvania, and we thank them very much for that. And promoting learning opportunities, right? We have health curriculum in schools, a lot of them. Let's think about what's being taught in those. Let's think about what those educational standards are. Let's think about the conversations that we're having. Are they sometimes difficult? Yes. Do they need to be occurring? Yes. We live in places of multiple truths. Things can be difficult and still need to be talked about, right? If we look at the other end of the healthcare continuum, right? Our LGBTQ elders, an incredibly growing population that quite frankly doesn't always get the visibility, right? And this is a big one for me, especially when folks come into our communities to do, marketing, or, I had folks from the media services office of the state come with me to a Pride Festival and say, what do we need to capture? And I said, you need to capture the actual Pride experience of lots of different types of folks, right? And so when they caught the Pride experience of two of our LGBTQ elders walking arm in arm down the street with their two canes, I said, that will be displayed very prominently in your spread, right? It's not just all about us able-bodied, six-packed, I don't think I'm including myself in that, right? Like, leading the parade, like, look, Adonis, right? It is about everyone. And so, thinking about, what are some of those things that LGBTQ elders can use? One is increased visibility. One is us to acknowledge, right, that LGBTQ folks over 65 in Pennsylvania exist and their population is growing. We know, right, when you think about when things like marriage equality has happened historically in our nation, and where these folks have been living pre that, there is right now for LGBTQ seniors far less familial support, right? And so many, many more of our LGBTQ elders are living in isolation. And again, is isolation health? I would argue it's absolutely not. We know that there are higher poverty rates, again, thinking about socioeconomic status. There can be reduced healthcare to access and services. As we know, that can affect all of our populations. These are where we see higher rates of folks still living with HIV and AIDS. And so things like our long-term healthcare facilities and our area agencies on aging and all of the folks doing community impact work with seniors need to be thinking about all of these things. And we need that community engagement with competent providers. You would not believe some of the horror stories that we hear from LGBTQ elders. I had to sit in a room where two women who have been married for 40 years, right, got married in a civil union, then when marriage equality happened, said, what the heck, we like parties, why not have another? Got married legally. One of them is unfortunately dealing with a chronic illness. And so they went to a facility known to have treatment for this specific problem, and sat with someone and were told you meet all of the financial, you meet every qualification, we would love to have you, but understand where our values lie, and you could move in here, but you would live in 2 separate apartments. Now I just want you to think about, right, if your loved ones, your parents, your grandparents, those in your life who are aging called and said, we're being told we're being separated. Probably most of us would not just say, let me know how that goes, right? We would probably be on the phone to someone, probably not in the nicest tone, saying, who do you think you are to tell my parents after a 40-year marriage that they are going to live separately? And yet, this is happening here in Pennsylvania to our LGBTQ elders. We also know that some of our, you may appreciate this one, we work very closely with the Department of Aging at the state. They wonderfully sort of put out to their AAAs a diversity survey and said, we'd just like to hear some of the work that you're doing around diversity. And a few of those responded, so I want to give them credit for that, but their responses were essentially, NA, we don't have diversity. Survey says, right? So we have some work to do, right? But how do we have our folks working with seniors think about, again, intentionally thinking about LGBTQ seniors, thinking about when they have community development, when they have things to bring folks together. Do LGBTQ seniors feel welcome in those spaces? Are they talking about them? Are they thinking about the unique needs there? And how can we be promoting health for LGBTQ seniors? Well, what about the rest of us, right? What about the general population? So what I would tell you is I'm going to tell you what health isn't. And I'm going to do that by telling you some of the narratives again that we've listened to from folks across Pennsylvania. Health is not going into a facility and experiencing judgment, discomfort from staff, and essentially being refused care. Healthcare is not having to talk to a medical provider who says, I don't really get you, or I don't really have a background in assisting with your needs. Healthcare is not being a person who is transgender or gender nonconforming and being asked incredibly uncomfortable questions in very disrespectful ways that their cisgender counterparts would not be asked. Health is not being a married couple looking at a long-term healthcare facility and being told you'll have to separate. Health is not being told that our shelter is based on religious principle and therefore the one place that you could be provided housing is now rejecting you. Health is not going into an urgent care with a broken wrist and being told we don't really specialize in gender care. Now I don't have an MD. I am not a healthcare provider, but I am pretty sure, just going to go out on a limb here, that I could diagnose that wrist is mended the exact same way as anyone else's wrist, and that no hormones or any time a reproductive organ comes into play in mending that wrist, right? And we can sort of say, oh, that's laughable, but again, it is what is happening. And quite honestly, with some of the rollbacks we're seeing from the federal government, it is opening the door for what will continue to be able to happen. So those things are not health. What is health? Well, one of the things our commission is working on very ardently above all other is, as you heard Jessica talk about, passing non-discrimination comprehensively. You see, when I go into spaces still in Pennsylvania, I will often say things like, how many people believe that, you could maybe put a picture of your spouse, partner, husband, wife, whoever it might be, up on your cubicle and be told, is that you? Are you married to that person? Oh, I'm not good with that, you're fired. And people are like, oh, no, that would never happen in Pennsylvania. It is. It is happening. Now, I will say that I love the moments where that gets like the Barbara Bush pearl clutch, right? People are like, oh, right? But it is happening, right? Because we do not consider things like gender identity expression and sexual orientation to be considered discrimination here in Pennsylvania. So folks, based on those characteristics, are being denied housing, they are being fired from jobs, they are not getting promotions, they are being turned away from public accommodation, right? They are going into a restaurant and told, we don't want to make a scene, but could you please just leave? Our staff is uncomfortable with you being here. And it is happening to some of them every day. I will tell you very quickly the narrative. I spoke at a college campus, and a woman came up to me afterwards, and she said, I want to share something with you, and I don't share it with a lot of people, but I feel compelled to. She said, my wife and I have been together for 10 years, and we parent 3 children. And where I work, I have never put a picture of my children in my workspace. Because to talk about my children would lead to talking about who I parent those children with, and I am too afraid that I would lose my ability to provide for them. So essentially when I go to work, I wipe their existence away. And I deal with the guilt of doing that every day. I guarantee you she's not healthy. I wish that she was somewhere where, how many of us would love to just eradicate our children from the ways that we talk about ourselves and the things we're proud of. And yet this is what people are doing in Pennsylvania every day. So where are we? We are very fortunate to have rock stars in both the House and the Senate who have again put forward bills for comprehensive non-discrimination. They are currently in both the House and the Senate assigned to committee, and we are essentially waiting for those committees to bring up the bills, to address them. We will provide any testimony and resources and support we can through that. Our hope, obviously, is that those committees vote on them to go to the entire floor for a vote. If I may leave you with one call to action, one website, www.pavalues.org. pavalues.org. We're very fortunate. The Pennsylvania Youth Congress is leading the charge in the grassroots advocacy around non-discrimination. This is their landing website for all things non-discrimination. You can follow up-to-date information about what's happening. There's also places for businesses and community organizations to sign on and be supportive of non-discrimination. Faith leaders, individual testimony, community groups. So we would love everyone to navigate that website and to be considering how you can lend support there. What else can we do? We need to create welcoming, inclusive, competent, and medically efficient centers so that all LGBTQ people can thrive and receive the medical treatment with respect that they need within their providers, right? It is not okay to say, well, there's one in a 30-mile radius, so nobody else has to do it. Most of us are not traveling 30 miles to our medical provider. Most of us can say, who's the doctor that's walkable, and I know I can get treatment there, so there is no reason why LGBTQ people should be treated any differently. We need to encourage more health screenings, prioritize chronic disease prevention, promote tobacco cessation, right? Leading cause of death amongst queer Pennsylvanians. We need to take our own health back into our hands and talk about tobacco cessation. And again, there's going to be lots of breakout sessions where you'll hear all kinds of strategies around these. We need to continue to enhance data collection. And then we need to think about what each of our own organizations can do, right? In our own non-discrimination policies, in, right, the culture and the climate that our patients, that our consumers are telling us we are, right? We can believe we're anything, but is that the experience of the consumer who has walked in the door? We need to think about our facilities and make sure that they're inclusive. We need to think about our vendors and our subcontractors and those we hire. Are they affirming the same values that we are? And we need to be present in LGBTQ spaces, right? For those of you here around Allegheny County, you have one of the largest areas of multiple pride festivals and multiple queer spaces happening. Are you present in them? I'm sure we would love to see your organizations be present and collaborating with groups here who are fighting very hard for LGBTQ people. I'm going to leave you with, right, a few challenges. One is don't fall victim to conference fatigue, right, which is like 2 days, LGBTQ health, all of these strategies, and then like Wednesday afternoon, you're like, oh, that phone that I haven't looked at, right, and like 46 emails that I need to respond to, and oh my gosh, I have a Thursday meeting that I forgot to prep for, and all of a sudden on Thursday, it's like, oh, we're right back into it, right? Actually consider, right, a few takeaways that you will hear from all of the valuable sessions that you will get here, right? What is it that you can do on the very micro level, individually, with your organization? Again, move that ticker 1%, because if we all choose 1%, we're going to get there a whole lot faster. Make sure you're networking with folks in this space. Don't fall victim to that, oh, I know my one little posse, and that's who I sat with all day, because it was really easy and it was really a lot better than having to like say, I don't know you and who are you, but collaboration will only come when we find who people are in this space that share our ideals, that share resources, that we can work together. And of course, I would tell you, right, on the very individual level, what we can do in true allyship is not assume that everybody is heterosexual, cisgender, and gender conforming when we meet them, is to educate those from our organizations not able to be in this space. Go back, have 10 minutes at the next staff meeting and say, I really want to talk about some of the things I learned at this conference and some of the things we can empower our organization. Interrupt prejudice every time you hear, see, or experience it. Do not act nervous, uncomfortable, or angry when somebody brings up their gender identity, expression, or sexuality to you, whether personally or professionally. Respect confidentiality and know where and when to seek and refer resources. I'm going to be with you the next 2 days, so I hope I get to meet you on the very individual level and hear about the wonderful things you're doing and the ways that our commission can collaborate with your wonderful groups. I want to share my secondary thanks to the folks that put this together. Please do make sure to appreciate that. If you have ever been on a conference planning team, you know, right, it to all of us seems like seamless and easy, and it took hours and hours of preparation for this to happen. So thanks to all of the partners that put this together, and I hope that you have an amazing 2 days of learning and networking here. Make it a great conference, everybody.